Minister, you're aware that I raised this on behalf of Rebecca Price and Pat Kiley, whose baby Christopher was wrongly diagnosed with fatal fetal abnormality in Hollis Street in March 2019, and baby Christopher's life was ended wrongly in 2019. The family have sought a review to make sure that that happens to nobody else, that no other family grieves in the way that Rebecca and Pat do on behalf of their baby and with their baby. I know that the family has met you and met your officials, and I'd like an update on the review on fatal fetal abnormalities to ensure that this happens to nobody else.
Can I thank the Deputy for raising this. In 2019, the HSE recognised the need for increased awareness surrounding the correct identification and diagnosis of fatal fetal anomalies. The clinical review of termination of services as provided for under Section 11 of the Health Act 2018 was commissioned by the Chief Clinical Officer. From notifications I receive under the Act, I understand that termination services are provided under Section 11 for approximately 100 cases a year. The HSE has confirmed that the clinical review group met for the first time on the 29th of April of this year. The terms of reference were ratified by the Review Oversight Group in advance of this meeting. The Department of Health will provide, or I'll ask the Department to provide the terms of reference directly to the Deputy. The HSE is advised that the clinical review will identify the requirements to enhance the provision of termination services under Section 11 of the Act. It's going to work collaboratively with the stakeholders. There's quite a number of stakeholders involved. This will be both in the delivery and the management of termination under services regarding fatal fetal anomalies and or life-limiting conditions diagnosed during pregnancy. The group will engage with service users so that their experience of the service is central to the process. It's absolutely essential that we hear not only from the clinicians, not only from the scientists, but from the women themselves, from the people involved in using the services themselves. Recommendations will then be made and submitted to the HSE Oversight Group. And the HSE have stated that the review will examine areas including screening, diagnostic services, genetics, in the context of fatal fetal anomalies, life-limiting conditions. It will examine access to the multidisciplinary expertise that is required and which is being invested in, including clinical genetics, other specialties, counselling services, including genetic counselling, which is something that needs to be put in place, bereavement and other support user services as well.
Thank you, Minister. And I'm very glad to hear you mention the role of clinical genetics, because, of course, this could, if that had been done in this case, it simply wouldn't have happened. If there had been an external review, the parents wouldn't have felt the need to go to the High Court to try to highlight the circumstances of this case. It cannot be that hospitals are allowed to review themselves. And I thank you for expanding the number of public interest directors in the new National Maternity Hospital, which is an important response to cases like this and many other cases where parents are highlighting problems that happen within maternity hospitals and where maternity hospitals don't listen and don't allow for external review. It is simply essential. This happened in 2019. I know that they met you in July 2021, and I see the terms of reference from the 29th of April. It's essential that that include clinical genetics. It's essential that they be involved. But it's also, parents need to have sight of that as well, and I'm not clear whether Rebecca and Pat have had sight of that on foot of the correspondence with the HSE. I see a letter to their solicitor, but I'm not sure that they've had the detail that is appropriate. I might come back in then.
Thanks, Deputy. I will this morning engage with the HSE and with the Department to make sure that they do have full sight of this. The HSE has acknowledged that this has taken a long time to put together. There is a very eminent chair has been appointed to this work. That's Dame Leslie Regan. She's the Professor of Obstetrics and Gynecology at Imperial College in London. She was identified as suitably qualified. She's an independent person to lead the review, which is one of the things that was requested. I think one of the things that's very important. Professor Regan was also President of the Royal College of Obstetrics and Gynecology in the UK from 2016 to 2019, and she's currently Honorary Secretary of the International Federation of Gynecology and Obstetrics. So it has taken a long time to put together, and the HSE has acknowledged that. One of the positives that has come out of this is the HSE has identified an eminent international independent expert to lead this review, and I have no doubt that the Professor will bring very important international expertise to this important review. And to the Deputy's question, yes, genetics, genetic counselling and all of that is going to be included.
It's essential, and we have very eminent geneticists in this country as well. Willie Reardon, who was involved in this case, is a very eminent geneticist, and I know has been a great support to Rebecca and Pat. And thank you for confirming that about Professor Leslie Regan. I know Rebecca and Pat have looked to meet with her, and I hope that that can be facilitated. But as you're aware, something going wrong in a maternity hospital is an absolute tragedy for any family from which it's very difficult to recover. Where something goes wrong, either the death of a child or the injury to a child that could have been avoided, Minister, I know you know, it is even more difficult to recover from than other cases. And all parents want to do is ensure that it doesn't happen to anybody else. And that has been the motivation entirely behind Rebecca and Pat's campaign to try to make sure that this can never happen to any other family who have wanted a baby in the way that they have wanted a baby, as lots of people do. It is essential as well, Minister, if I might suggest, that there is oversight of private clinics, private fertility clinics, that they're covered by the clinical indemnity scheme, but it's not clear the oversight that we have over them. It's not clear what's happening about notification to the incident management scheme with the State Claims Agency. I've raised this through the Public Accounts Committee, but it is essential that they are overseen. If they're going to receive the benefit of the clinical indemnity scheme, they must be overseen in every way too.
Minister, to conclude.
Thanks, Deputy. I'll ask the Department to revert to you on a note in terms of the current oversight situation, and please feel free to get in contact with me to discuss when you've seen that. There's two additional things happening which are relevant. One is that in this year's budget, I've allocated €1.5 million specifically to perinatal genetic services. So we know that there is more that needs to be done. We know we need more expertise in this. So €1.5 million has been invested via NWHIP to grow that service. And secondly, as you may be aware, Dr. Peter McKenna, who was leading NWHIP, is now leading an adverse incidents team, and is going to be looking at cases around the country where things have not gone as they should have, specifically to the Deputy's point, to make sure that we have very quick and very important feedback for all of the reasons the Deputy has laid out. I'm sure he would, Deputy. Yeah.